Good morning, everybody. Today is our class with the course Midwifery Care in Postnatal, and we will talk about a basic concept of midwifery care in postnatal. Let we see the definition of postnatal period. Postnatal period is the situation that begins immediately after childbirth as the mother's body, including hormone levels and uterus size, return to a non-pregnant state. It means that all of the reproductive organ will be back like when the mother or the woman haven't pregnant yet. The term of puerperal period or immediate postpartum period are commonly used to refer to the first 6 weeks following childbirth. So it means that duration of postnatal period is 6 weeks and it starts following childbirth. And we also have a definition of postnatal period that is referred to finished labor until the reproductive organ back to pre-pregnancy state. I think it's quite similar with the first definition. We have more than one term for postnatal period. We can say postnatal, postpartum, or puerperium. Okay, we move to the stage of postnatal period. Uh, we know there is three of stage postnatal period. We said for initial or acute phase, and then subacute postpartum, and then delayed postpartum. Initial phase that start at 6 and 12 days after childbirth. Subacute postpartum period, which lasts 2 until 6 weeks. So this is 2 until 6 weeks. We can say subacute postpartum period. And the last is delayed postpartum periods, which can last up to 6 months. So you know from this definition that the length of postnatal period is until 6 months. Now we try to understand one by one of stages of postnatal period. Initial or some experts say that immediate postnatal or postpartum period. In this time, the mother is typically monitored by nurses or midwives as a complication can arise. So some complication possible arise here in this period. The cause of complication is detach of the placental side and episiotomy of perineal laceration result in postnatal bleeding or postnatal hemorrhagic. So bleeding here can be cause of detach of placental side, and the other one is because of episiotomy or maybe perineal laceration that happened during labor. In the subacute postnatal period, some complication that might occur is deep vein thrombophlebitis. You know, thrombophlebitis is the something happen in the vein, and this is like infection, and then postpartum infection, and also possible here is urinary incontinence. So this is the three of example of complication during subacute postpartum or postnatal period. In the delayed postnatal period, what is happened here? The muscle and connective tissue return to a pre-pregnancy state. Recovery from childbirth complication in this period, such as urinary and fecal incontinence, painful intercourse, and pelvic prolapse, is no more happen. It means this is a recovery time actually. So many complications that happened before, like fecal incontinence and then painful during intercourse or sexual intercourse and then pelvic prolapse, it will be disappear in this time. And it's still problem like hair loss, so don't be surprised when the mother during her 3 until 6 months maybe the hair is starting loss. It's okay because that's happen in this period, and also some thyroiditis. Now we move to the aims of postnatal care. As a midwife, what is our aims when we take care of postnatal woman? Actually, we want to support the mother and her family in the transition to the new family role and response to their need. So we have to give understanding for the mother what is the role that she have to when she already become a mother, but she also still a part of the family. So many roles she have done here. So they really need our support, and we have to understand the needs of the postnatal woman. For example, they need the nutrition, they need the rest, and they need help for physical activity or daily activities. And the other aims of our care for the postnatal woman is we want to do prevention, early diagnosis and treatment of complication of mother and the infant. So we don't want the mother and the infant have a problem, and we will do prevention here. We also want to maintain the psychological aspect of the mother, because we know that there is a psychological changes that happen during postnatal period. And of course, the mother need the counseling on the baby care, because usually they don't know more how to take care of the baby, how to take about the baby, how to hug the baby, how to breastfeed, and something like that. So here, after uh, become our aim as well, we want to support the mother, give a breast milk to the baby. And counseling on maternal nutrition, of course, the mother needed some nutritious food and enough of water or liquid needed by the mother during postpartum, and especially when the mother is breastfeed the baby. We also uh, preserve counseling and service provision for contraception and the resumption of sexual activity. So we don't want the mother get another pregnant during the length of between first pregnant with the second pregnant is very close. So we try to give a counseling about contraception or family planning for the mother. And what is our role as a midwife, and what is our responsibility as a midwife? And here we will look at one by one. The our role and our responsibility is continue supporting. We have to continue give a support. What is the support? Feel the needs, reducing physical and psychological tension, because we know that mother have a high tension during postnatal period. So we have to reduce physical and psychological tension of the mother, and then promote the relationship of mother, baby, and the family, because three of this is one part. So when the mother have a problem, the baby will be have a problem as well, and also the family. When the baby has a problem, so the mother will have a problem and the family as well. And also when the family have a problem, mother and the baby will be impacted as well. So that's the mean of why we have to promote the relationship of mother, baby, and the family. As a midwife, you also have to develop regulation and planning program for the mother and the child. It's like when the child have to be immunization, have to get immunization, and then when the mother have to get the contraception or something like that. So you have the role to have you have to give the regulation and planning program for the mother and the child. And there is the other role and our responsibility. When there is a complication and we have to refer the mother, we have to do that. By what? By complication and referral need detection. We have to detect. We have to detect, is there any complication of this mother, and should we have to refer the mother or the baby, something like that. And counseling of bleeding prevention, it is something important. We have to explain the mother how to prevent the bleeding during postnatal period. We also have to explain the dangerous sign in postnatal, and how to speedy recovery. What should the mother do to get the speedy recovery? And we also have to explain about the mother and child need. And our role again, midwifery care management. We have to manage the mother and the baby using a midwifery care management, that we know that including of assessing, diagnosing, planning, implementing, and evaluating. And the last, do all of role and responsibility with professionally. So giving midwifery care professionally is our responsibility. Next, when the midwife have to visit a postnatal mother in the 3 hours until 3 days, we need to, and what the midwife do, what the midwife should do in this time. You need to check for the uterus contraction. It is very important in order to prevent the bleeding. And then do initial breastfeeding. Don't forget to breastfeed the baby to the mother, and prevent hypothermia in the baby. What should we do? We just keep the baby warm. Keep in the normal temperature room, and then give a blanket for the baby, and hug the baby or give the baby directly to the baby of the mother. That's how we can prevent hypothermia in the baby. In the 4 until 28 days, the situation is come better, but we still have to assess the uterus involution. We have to make sure that the fundal height is normal, and then we have to check, is there any fever in the mother as a symptom of infection, and is there any abnormal bleeding and infection? How about the mother's sleep and rest? Is it enough? How about the nutritious food and the water need? Is it enough for the mother, or the mother lack of nutritious food? And we also have to know proper breastfeed. I mean, the mother can breastfeed properly. And also we have to check, are the mother already take care the baby by herself, because actually it's very important for the mother to take care the baby by herself, not by other people. Other people is just supporting system, but who have to do when take care the baby is should be the mother herself. And another visit is in 29 until 42 days, uh, similar with the 4 until 28 days assessing, but we have to add the planning for family planning education and about contraception. So we have to start explain to the mother the kinds of contraception and the positiveness and the negativeness, but we have to underline that uh, she has to get family planning, she had to get contraception and make a safe reproductive system. So we can see here, this is like a good quote that we have to send this message to the mother, that to be a mom is awesome. See, to be a mom is awesome. Just tell this to the mother, so she will be proud because she is a mom, and she will be happy because she is a mom, something like that. Okay, that's all my presentation. Thank you. And you can learn more about this material in the module already in the healthy. And we will see in the Zoom meeting for just discussion. So you can write down your question and I will answer. And we will do interactive in the Zoom meeting. Okay, bye bye. See you.